Imagine closing your eyes tonight just like you've done thousands of times before. Your body relaxes, your breathing slows, everything feels completely normal. And then you never wake up again. No warning, no pain. You remember, just silence. This may sound extreme. However, as a doctor, I need you to understand something very important. I am Dr. Edward Wright. For over 10 years, I have served as a specialist surgeon, dealing with the delicate balance of the human heart and circulation. Throughout my career, I've stood in the operating room, fighting to reverse the damage caused by sudden strokes and cardiac events, many of which could have been prevented with the right knowledge. I don't just study these patterns in medical journals, I see them every day in my patients. That is why I am here today, not just as a surgeon, but as someone who wants to stop these tragedies before they ever reach my operating table. For many adults over 60, the bedroom can quietly become one of the most dangerous places in the house, especially during the night. Because every single night, thousands of people go to sleep believing they are safe, while their heart and brain are under hidden stress. And here's the part most people never realize. They weren't doing anything unusual. They were doing something completely normal, something they had done for years, something you might do tonight without thinking twice. As a doctor, I see the consequences of these habits regularly. But as a son, I'll be honest with you, this is what worries me the most. Because when I look at my own parents, I see them doing these exact same things, completely unaware that one small mistake at the wrong moment can change everything overnight. Let me explain something most people don't understand. Your body at night is not the same as during the day. While you sleep, your blood pressure naturally drops, your heart rate slows down, your brain enters a recovery state. This is supposed to protect you. But if something disrupts this delicate balance, even for a few seconds, the results can be serious. Blood flow to the brain can drop suddenly. Oxygen levels can fall, your heart rhythm can become unstable, and because you're asleep, your body may not react quickly enough to protect you. Now, before I show you the first mistake, I want to ask you something important. How many times do you wake up at night to use the bathroom? Once, twice, 3 times or more? Type your number in the comments below, because your answer can reveal more about your nighttime health than you think. Now let's talk about the first mistake, and I need you to pay very close attention here, because this is something almost everyone does without realizing the risk. Mistake 1. Waking up and rushing to the bathroom. Picture this. It's 2:30 in the morning. You suddenly wake up with the urge to use the bathroom. Your eyes are still heavy. Your body is not fully awake. And without thinking, you sit up quickly, stand up immediately, and start walking. This feels completely normal, right? But in reality, this is one of the most vulnerable moments of your entire night. Here's what's happening inside your body. When you've been lying down for hours, your blood is evenly distributed. Your heart is working calmly. Your blood pressure is slightly lower than during the day. Now, the moment you suddenly sit or stand, gravity pulls blood down toward your legs. And for a few critical seconds, your brain may not get enough blood. This is called a sudden drop in blood pressure, also known as postural hypertension. And in older adults, this adjustment is slower than it used to be. So instead of stabilizing instantly, your brain may experience a brief drop in oxygen. And that's when symptoms can appear: dizziness, blurred vision, weakness, or even a brief blackout. Sometimes there are no clear warning signs at all. I remember a patient, a 67-year-old man, active, independent, no major health problems. One night, he woke up to use the bathroom, just like he had done for years. He stood up quickly, took a few steps, and collapsed. Later, we found that he had suffered a stroke, triggered by a sudden drop in blood flow. Now I want you to think about this carefully. How many times have you done this in your life? Hundreds? Maybe thousands? And nothing happened? so your brain assumes it's safe. But the truth is, it only takes one moment, one unstable night, one sudden drop, one wrong timing. Let me ask you something. Do you ever feel slightly dizzy when you stand up at night, even for a second? If yes, that is your body giving you a warning. Don't ignore it. Now here's the good news. This mistake is completely preventable. And fixing it takes less than 30 seconds before you get out of bed at night. Don't rush. Stay lying down for a moment, then slowly sit up. And before you stand, do something very simple but very powerful. Move your feet. Gently pump your ankles up and down 10 to 15 times, then move your legs slightly. What you're doing is helping your circulation adjust. You're allowing blood to return to your brain before you stand up. This simple habit can reduce dizziness, lower the risk of falls, and help protect your brain during the night. But here's what most people don't realize. This is just the first mistake. And what comes next may be even more important, because the way you sleep every single night can quietly affect your heart and brain, without you even knowing it. In the next part, you're going to discover something that could completely change the way you sleep tonight. Now let's move to the second mistake, and this one is more dangerous in a different way, because unlike the first mistake, you're not awake when it happens. You're completely unconscious. You feel comfortable, you feel safe, but inside your body, something much more serious may be happening. Mistake number 2, dangerous sleeping positions. Let me ask you something honestly. How do you usually sleep? On your back, on your side, or on your stomach? Comment below, back, side, or stomach, because your answer matters more than you think. Most people believe that as long as they're sleeping, their body is resting properly. But as a doctor, I need you to understand something important. Not all sleeping positions affect your body the same way. Let's start with the most common one. Sleeping on your back. For many people, this feels natural and comfortable. But in older adults, especially those who snore or have undiagnosed breathing issues, this position can create problems. Here's why. When you sleep on your back, the muscles in your throat relax, your tongue can fall slightly backward, and your airway can become partially blocked. Even if you don't have diagnosed sleep apnea, your breathing can become shallow, irregular, or briefly interrupted, and every time that happens, your oxygen levels can drop. Your brain senses this change, and your body reacts. Your heart rate increases, your blood pressure rises, your body enters a stress response. This can happen multiple times during the night without you even realizing it. And over time, this repeated stress can affect your heart, your blood vessels, and your brain. This is one reason why conditions like high blood pressure, irregular heart rhythms, and even strokes are often linked to poor sleep quality. I once treated a patient, a 72-year-old woman, who believed she slept perfectly fine, no complaints, no discomfort. But her family noticed something. She snored heavily, and sometimes stopped breathing for a few seconds before gasping. She had no idea this was happening. Later, she was diagnosed with sleep apnea, a condition that had been silently stressing her body for years, and, like many people, she only discovered it after a serious health scare. Now let's talk about another position, sleeping on your stomach. Some people prefer this, but it creates a different kind of strain. When you sleep face down, your neck is turned to one side for long periods. This can lead to neck tension, poor spinal alignment, and less efficient breathing. Your chest is slightly compressed, which can make deep breathing more difficult. Over time, this may not feel like a big problem, but night after night, it can contribute to physical stress on your body. Now here's the safest option for most people, sleeping on your side, especially for older adults. This position is generally more supportive for breathing. Sleeping on your side can help keep your airway open, support more stable breathing, reduce strain on your heart. For some people, sleeping on the left side may also help with circulation and reduce pressure on certain organs. Now, this doesn't mean you must force yourself into one position all night, but becoming aware of how you fall asleep can make a real difference over time. So, tonight, pay attention to this. How do you fall asleep and how do you wake up? Because small adjustments here can have long-term benefits for your health. Now, before we move to the third mistake, I want you to think about something else, because what you do before sleep can be just as important as how you sleep. And this next mistake is something millions of people do every single night, believing it's completely harmless or even healthy. Mistake number 3, eating the wrong foods at night. Let me ask you something. What do you usually eat before going to bed? A light snack? Something salty? Leftovers? Tea with biscuits? Be honest, because this habit could be affecting your heart more than you realize. Here's what most people don't understand. At night, your body is designed to slow down. Your heart should relax. Your blood pressure should decrease. Your system should enter recovery mode. But when you eat certain foods late at night, you interfere with this natural process. Let's start with one of the biggest problems: high sodium foods. Things like processed snacks, packaged meals, soups, pickles, salty leftovers. These foods can cause your body to retain fluid. This increases the volume of blood in your system, which puts extra pressure on your heart. Instead of your blood pressure dropping at night, it may stay elevated or fluctuate more than it should. And over time, this can increase the risk of heart strain, blood pressure problems, and cardiovascular events. Now let's add another factor: late digestion. When you eat close to bedtime, especially heavy meals, your body has to stay active to digest the food. Your heart pumps more blood to your digestive system. Your metabolism remains active when it should be slowing down. In simple terms, your body is working when it should be resting. I remember a patient, a 69-year-old man, who had a habit of eating very late dinners, around 10 or 11 p.m., and then going straight to bed. Over time, this pattern placed continuous strain on his body at night, and eventually he experienced a serious cardiac event during sleep. So now, I'm not saying food alone caused it, but his nighttime habits played a significant role. Now think about your own routine. Do you eat late? Do you go to bed with a full stomach? If yes, this is something worth adjusting, because even small changes here can support better rest for your heart. Now here's something simple you can do. Try to finish your last meal at least 2 to 3 hours before bed. Keep it light. Avoid heavy, salty, or highly processed foods. This allows your body to digest properly, relax naturally, and transition into restful sleep. And that makes a real difference over time. Now let's step back for a moment and look at the bigger picture. These 3 mistakes: rushing out of bed, sleeping in the wrong position, eating the wrong foods at night individually. They may seem small, but together they can place unnecessary stress on your body at the most vulnerable time of the day. And the most concerning part, most people don't even realize it's happening, but now you do. And in the next part, I'm going to show you something simple, but very powerful, a short routine that takes less than 30 seconds and can help your body adjust safely during the night. What you're about to learn next is something you can start using tonight. Now, before we end this video, I want you to pause for a moment and think about everything we just talked about. Every single night, your heart is working, your brain is recovering, your body is trying to protect you. But small habits, things that seem completely normal, can quietly turn that protection into danger. And the truth is, most people don't find out until it's too late. But you're here right now. You're aware, and that gives you something very powerful: control. Now, I'm going to show you something simple
something most people have never been told, but it can make a real difference.
The 30-second life-saving routine. This is what I tell my patients. And honestly, this is what I want my own parents to do. Every single night, before you get out of bed, especially if you wake up during the night, don't rush. Instead, do this. Step 1. Stay still for a few seconds. Let your body wake up slowly. Let your brain reconnect with your body. Step 2. Sit up gently. Don't jump. Don't rush. Just slowly bring yourself upright. Step 3. Ankle pumps. 10, 15 times. Move your feet up and down like you're pressing a pedal. This activates your circulation. It helps push blood back toward your heart, and more importantly, toward your brain. Step 4. Heel raises 5 to 10 times. Lift your heels slightly, even while sitting. This stimulates blood flow in your legs, reducing the risk of sudden drops in blood pressure. Step 5. Then stand up slowly. Now your body is ready. Now your brain is getting enough blood. Now the risk is much lower. This entire routine takes less than 30 seconds. But it can prevent dizziness, falls, sudden drops in blood pressure, and even serious events like strokes. Now let's take this one step further, because it's not just about one moment, it's about your entire night routine. A simple, heart-safe night routine. You don't need anything complicated, you don't need expensive treatments, you just need consistency. 2 to 3 hours before bed, eat a light dinner. Avoid heavy, salty, processed foods. Give your body time to digest. 1 hour before bed, reduce stress. Avoid screens and intense emotions. Let your body calm down before sleeping. Check your sleeping position. Try to sleep on your side. Make sure your pillow supports your neck. Keep your room comfortable, not too hot, not too cold, during the night. If you wake up, don't rush. Do the 30-second routine. Move slowly in the morning. Sit up. Slowly give your body time to adjust. Start your day gently. This is not complicated, but it is powerful, because what you're doing is this. You are respecting your body's limits. You are working with your physiology, not against it. And that is what protects you. Now, I want to say something personal. As a doctor, I've seen too many cases where something small led to something irreversible. But as a son, this is different, because when I think about my own parents, I don't want them to be lucky. I want them to be safe. And that's exactly what I want for you. Not fear, not anxiety, but awareness. Because once you know this, you can change it. And those changes can mean the difference between a normal night and a life-changing event. Now, before you leave, I want you to do something important. First, comment below. I'm changing this tonight, because making that decision matters. Second, like this video. Not for me, but because it helps this message reach someone who might need it. Third, share this video with someone you care about, a parent, a relative, a friend, because you may never know whose life you protect. And finally, subscribe to the channel, because every week I share simple, practical, life-saving information for people over 60. Remember this, sleep is supposed to heal you, not harm you. Protect your heart, protect your brain, and take control starting tonight. I'll see you in the next video.